this is the big question on everyone's minds, doctor. Should schools reopen or not? That is the big story of this week. Schools across India have been shut since mid-March 2020. This is in view of the COVID-19 pandemic. Students have lost a year of their school lives, their academic year. Digital school, is not accessible to all. Many from low resource communities are disadvantaged. Now, for viewers joining us, let me just give them the big picture. Delhi schools have reopened after a 10-month hiatus. The Delhi government has allowed schools to reopen for class 10 and 12. This was on the 13th of January in order to help students prepare for the board exams. Now, after a gap of 11 months, schools in West Bengal reopened on Friday from classes 9 to 12. They say with strict adherence to COVID-19 protocols. In Hyderabad, schools have reopened. The Gujarat government today announced reopening of schools for students from classes 6 to 8 from the 18th. Now, all these schools are saying attendance will not be compulsory for students, though online classes will also continue. But schools are reopening. Doctor, parents are in a dilemma. They have to make a tough decision, possibly one of the toughest decisions. Should they send their kids to school or not? Now, later, when? How do they evaluate the pros and cons? Your advice, please.
So I do agree with you. It's a tough dilemma because you're looking at two broad things. One is the risk of the child getting infection. The second is, like you rightly said, there's been a big loss as far as education is concerned. And I'm not saying that the education through online was bad, but that's not how school should be. It's not only the online training that is important for children, it's also important to have a social interaction, character building, meeting friends, and that is also part of childhood, which for 1 year a lot of children have lost. As a matter of fact, I remember one parent telling me that their child now thinks that the school is only staring at the TV screen, at the computer screen. And that's all school is all about. And this is a child in the KG or first class. So children at that age have sort of lost or have a different concept of what school is all about. So it's a balance that we have to do. It seems that currently our cases are really down and the infection rate is low, and therefore one has to try and see what is the risk-benefit analysis and look at that. It seems that the risk is low, but I would really have one caution that we need to do this with very close surveillance. If you are going to open schools, we must have a very good close surveillance for any child who has flu-like symptoms. A protocol should be placed in place so that any child who has symptoms like that should not come to school. There should be some degree of availability of testing if that is required. We could do the rapid antigen test if it is needed. So if we develop a SOP, I think at some point in time we will have to open schools because it's been already, like you said, more than a year or almost a year, the schools have been shut down.
So, and there's only so much that the school can do. So parents also have to take responsibility. But I want to, establish one thing, doctor. This is not just in India, right? This is happening globally. The U.S. Centers for Disease Control and Prevention, that's a top U.S. health body, says schools can reopen. They've issued COVID guidelines. Their strategy emphasizes universal masking, hand washing, disinfection, contact tracing. But, it spends, I just read it before coming in to interview you, it spends relatively little time on the subject of ventilation, right? Because is this the main transmission route for the virus? Because in the end, students study in a classroom.
Ventilation is very important, and like I had said, we need to develop an SOP which is more Indian based. How do we do it in our setup considering our constraints and the things that we can do? But ventilation is very important, and as we move into schools opening, there has to be good cross ventilation. There is a lot of data which suggests that if you have aerosol generation and the ventilation is not good enough, the chance of infection are much higher, and therefore good cross ventilation should be actually also something that schools need to look at. Sometimes I feel that having a class under a tree is probably the best thing because that is the best way to really protect oneself from the infection. You have a nice cool breeze blowing and you may not have a chance of any exposure.
Another reason for all of us to not cut down trees in our country. But doctor, you've touched upon this, so I just want to ask you more in depth. What about parents who live with grandparents? They're stuck between a rock and a hard place, right? I mean, it's different for nuclear families, but there are still many in India who live in joint families. What do they have to keep in mind? Because you said children, are they carriers? Aren't they?
This is a big dilemma, and this is not only now, it's been there for the last 1 year, not only for parents and who's having grandparents are living, but even for healthcare workers. Many healthcare workers come from joint families and they work in the hospital, and they're all worried that they may carry the infection and give it to the grandparents whom they have a very close bond with. So this is something that we need to develop, and that's why COVID appropriate behavior even at home needs to be aggressively followed, whether it's hand washing, wearing a mask, and making sure that exposure is not there, or the house is properly ventilated. Those practices we really need to continue to follow. Unfortunately, in many cases we have let our guard down, and that is a cause of concern, because we are in a good position, but it could change any time, and therefore we need to be really, really careful.
Okay. And we've talked about senior school students. They have a greater academic loss, or much more to lose academically. Every day they skip school. But what about nursery school? Because their learning graph may not be steep, but as you point out, they need socialization. So our younger children we talk about, because the vaccine testing is from 6 onwards. What about nursery school, grade 1, grade 2? Are they at lower risk than older children? Should those classes be prioritized and opened first?
So nursery children, nursery school-going children are likely to have a milder infection, but we really don't have a vaccine for them, and it will take a much longer time for that to come out, because that will need more regulatory approvals, and therefore one has to be careful. Again, I think one will have to go by a symptom-based approach, and trying to see that those children who have flu-like symptoms, who seem to have COVID infection, are isolated properly, not only from coming to school but also at home, so that they don't spread the infection to others.
All right, Dr. B, I dare sum up. I think what you're saying, kids are not likely to be commonly infected with the virus, but could there then be a problem of the staff, the school, the teachers, etc., who are also at risk then?
That is there. There is always this problem that the teachers could be at risk. There have been instances where a large number of teachers and school children have got infected, and this is always a cause of concern. This has happened even once during our H1N1 pandemic. I remember at that point in time in Pune, a boarding school, there were a large number of people got, students and the teachers got infected. So we need to be extra cautious, and I think the same precautions teachers need to take. If they have any symptoms, please get your self-tested as early as possible. Please isolate yourself, and remember that you have a bigger responsibility, because you can spread the infection to the children in your class.